Welcome to Lecture 1, COVID-19, an insight into research from beginning to end. Myself, Dr. D.S. V.Z.K. Kaladhar, Associate Professor, Microbiology and Bioinformatics, UTD, Atal Bihari Vajpayee University, Bilaspur, Chhattisgarh. Let us see about Volume 1, History of Infections. Introduction. Humans are thinking that they are powerful living species on the earth and can eat any species or any matter on earth. There are several restrictions provided in ancient systems of medicine in every country. Infections were the principal cause of death, killing of 2 to 4% of human populations every year. Most of the humans also keep the dead species inside the houses as decorative items which are available in the market. It's not safe. You can lose your life at any point of time. Hence prefer no smoking, no alcohol, no prostitution, drug-free, gun-free, and no speed while driving. History. The history of infectious disease is also the history of individuals who have described infections, differentiated one infection from another, isolated or characterized the pathogenic microorganisms, developed diagnostic tests, pioneered treatments, developed preventive public health measures, or developed vaccines or chemoprophylaxis to prevent infections. The history of infectious diseases is a sage of the exploit of the great clinicians and microbiologists of the past who have worked on bacterial toxins, parasite life cycles, bacteria, virus, fungi, rickettsia, chlamydia, mycoplasma, and protozoa. Infectious diseases also may be viewed from the impact on human populations. Infectious diseases have had a profound effect on migrating human populations and vice versa. Many people would like to think that the current society is advanced and sophisticated and is relatively immune from the devastating effects of infectious diseases experienced by the people in the ancient world. The emergence of retroviruses as a world pandemic should leave little reason for comfort. The new infectious diseases always are lurking, as attested to by recent outbreaks of plague in India, Ebola in Africa, severe acute respiratory syndrome or SARS in China, and MERS or Middle East Respiratory Syndrome in Arabia. With the advent of international air travel, improvement of radiation by mobile microwaves, etc., developments of technology, explosives, plastics, mutagenic agents, and extensive intercontinental interchanges of animals, insects, and humans, there is always the potential for the emergence of new and devastating infectious diseases. In the realm of infectious diseases, a pandemic is the worst case scenario. A timeline below of pandemics that, in ravaging human populations, changed the history. 430 BC, Athens. The earliest recorded pandemic happened during the Peloponnesian War. After the disease passed to Libya, Ethiopia, and Egypt, it crossed the Athenian walls as the Spartans laid siege. As much as two-thirds of the population died. The symptoms included fever, thirst, bloody throat and tongue, red skin, and lesions. The disease suspected to have been typhoid fever weakened the Athenians significantly and was a significant factor in the defeat by Spartans. 165 to 180 AD, the Antonian plague. The epidemic may have claimed the life of a Roman emperor, Lucius Verus. 250 AD, Cyprian plague, named after the first known victim, the Christian bishop of Carthage. The Cyprian plague entailed diarrhea, vomiting, throat ulcers, fever, and gangrenous hands and feet. City dwellers fled to the country to escape infection but instead spread the disease further. Possibly starting in Ethiopia, it passed through North Africa into Rome, then on to Egypt and northward. There were recurring outbreaks over the next 3 centuries. In 444 AD, it hit Britain and obstructed defense efforts against the Picts and the Scots, causing the British to seek help from the Saxons, who would soon control the island. 541 AD, Justinian plague, first appearing in Egypt, the Justinian plague spreads through Palestine and the Byzantine Empire and then throughout the Mediterranean. The plague changed the course of the empire, squelching Justinian's plans to bring the Rome Empire back together and causing massive economic struggle. It is also credited with creating an apocalyptic atmosphere that spurred the rapid spread of Christianity. Recurrences over the next 2 centuries eventually killed about 50 million people, 26% of the world population. It is believed to be the first significant appearance of the bubonic plague, which features enlarged lymphatic gland and is carried by rats and spread by fleas. 1100 AD leprosy. Though it had been around for ages, leprosy grew into a pandemic in Europe in the Middle Ages, resulting in the building of numerous leprosy-focused hospitals to accommodate the vast number of victims. A slow-developing bacterial disease that causes sores and deformities, leprosy was believed to be punishment from God that ran in families. The belief led to moral judgments and ostracization of victims, now known as Hansen's disease. It still afflicts tens of thousands of people a year and can be fatal if not treated with antibiotics. 1350 AD, the Black Death. The Black is a form of bubonic plague due to bacillus bacteria, Yersinia pestis, that lives in bloodstream of fleas live in the fur of black rat. A child of the famine would be the adult during the Black Death, responsible for the death of one-third of the world population. The second large outbreak of bubonic plague possibly started in Asia and moved west in caravans entering through Sicily in 1347 AD. The Black Death is native to be the Great Plains of northern Asia. It is still commonly there today. In the 1200s and 1300s, trade with China was expanding. The Crusades had introduced exotic products to Western Europeans and China was in the position to provide them. England and France were so incapacitated by the plague that the countries could be truce into their war. The British federal system collapsed when the plague changed economic circumstances and demographics. 1665 AD, the Great Plague of London. In another devastating appearance, the bubonic plague led to the deaths of 20% of London's population. As human death tolls mounted and mass graves appeared, hundreds and thousands of cats and dogs were slaughtered as the possible cause, and the disease spread through ports along the Thames. The worst of the outbreak tapered off in the fall of 1666 around the same time of another destructive event, the Great Fire of London. The Great Fire of London destroyed much of the centers of London, but also helped to kill off some of the black rats and fleas that carried the plague bacillus. 1817 AD, First Cholera Pandemic. The first of the 7 cholera pandemics over the next 150 years. This wave of the small intestine infection originated in Russia where 1 million people died. Spreading through feces, infected water and food, the bacterium was passed along the British soldiers who brought it to India where million more died. The reach of the British Empire and its navy spread cholera to Spain, Africa, Indonesia, China, Japan, Italy, Germany and America, where killed 1,50,000 people. Vaccine was created in 1885 but pandemics continued. 1855 AD, the third plague pandemic. Starting in China and moving to India and Hong Kong, the bubonic plague claimed 15 million victims. Initially spread by fleas during a mining boom in Yunnan, the plague is considered a factor in the Party Railway and the Taiping Rebellion. India faced the most subsequent casualties and the epidemic was used as an excuse of repressive policies that sparked some revolt against the British. The pandemic was considered active until 1960 when causes dropped below the couple hundred. 1889 AD Russian flu. The first significant flu pandemic started in Siberia and Kazakhstan, traveled to Moscow and made its way into Finland and then Poland, where it moved into the rest of the Europe. By the following year, it had crossed the ocean into North America and Africa. By the end of 1890, 360,000 had died. 1918 AD Spanish flu. The avian-borne flu that resulted in 50 million deaths worldwide. The 1918 flu was first observed in Europe, the United States and parts of Asia before swiftly spreading around the world. At the time, there are no effective drugs and vaccines to treat the killer flu strain. Wire service reports of the flu outbreak in Madrid in the spring of 1918 led to the pandemic being called the Spanish flu. By October, hundreds and thousands of Americans died and body storage scarcity hit crisis level. But the flu treated disappeared in the summer of 1919 when most of the infected had either developed immunities or died. 1957 AD Asian flu. Starting in Hong Kong and spreading throughout China and then into the United States, the Asian flu became widespread in England where over 6 months, 1400 people died. A second wave followed in early 1958, causing an estimated total of about 1.1 million deaths globally, with 116,000 deaths in the United States alone. A vaccine was developed effectively containing the pandemic. 1981 AD, HIV or AIDS. First identified in 1981, AIDS destroys a person's immune system, resulting in the eventual death by diseases that the body would usually fight off. Those infected by the HIV virus encounters fever, headaches, and enlarged lymph nodes upon infections. When symptoms subside, carriers become highly infectious through the blood and genital fluid, and the disease destroys T cells. AIDS was first observed in American Guy communities, but is believed to have developed from gorillas and chimpanzees virus from West Africa in the 1920s. The disease was spread through certain body fluids, moved to Italy in the 1960s, and then New York and San Francisco in the 1970s. Treatment have been developed to slow the progress of the disease, but 35 million people worldwide have died of AIDS since its discovery, and the cure is yet to be found. 2003 AD Severe Acute Respiratory Syndrome or SARS. First identified in 2003 after several months of cases, severe acute respiratory syndrome is believed to have possibly started with bats, spread to cats and then to humans in China, followed by 26 other countries infecting 8,096 people with 774 deaths. SARS is characterized by respiratory problems, dry cough, fever, and head and body aches, and is spread through respiratory droplets from coughs and sneezes. Quarantine efforts proved effective, and by July, the virus was contained and has not reappeared since. China was criticized for trying to suppress information about the virus at the beginning of the outbreak. SARS was seen by global health professionals as the wake-up call to improve outbreak responses, and lessons from the pandemic were used to keep diseases like H1N1, Ebola, swine flu, dengue, and Zika under control. 2019 AD COVID-19. On 11th March 2020, the World Health Organization or WHO announced that the COVID-19 virus was officially a pandemic after battling through 54 lakh 20,648 people and 3 lakh 44,258 deaths as on 24th May 2020, and the spread was not anywhere near finished. COVID-19 is caused by a novel coronavirus, a new coronavirus strain that has not been previously found in the people. Symptoms including respiratory problems, fever and cough and can lead to pneumonia and death. Like SARS, it spread through droplets and sneezes. Without a vaccine available, the virus spread beyond Chinese borders, and by mid-March, it has spread globally to more than 200 countries. These are different types of viruses that has been reported. Conclusion: human history has been much affected by infectious diseases since the dawn of history. The history of the world is intertwined with the impact that infectious diseases have had on populations. Evidence of smallpox has been found in 3,000 years old Egyptian mummies. Hippocrates wrote about the spread of disease by means of air, water, and places, and made an association between climate, diet, and living conditions. Investigators described miasmas as a source of infections. Epidemics of leprosy, plague, syphilis, smallpox, cholera, yellow fever, typhoid fever, and other infectious diseases were developed in the past. But we are now aware that emerging and re-emerging infections has become a significant worldwide problem after the emergence of COVID-19. These are the references used for the presentation. Thank you.